how nurses help babies who have HIE, brain injuries at birth. We're going to discuss this today, but it's going to be a little bit different. We're going to come at it from the context of potential medical malpractice is what caused this baby to suffer this traumatic brain injury. Now, what we're going to talk about today, not all nurses will communicate and do this. Not all nurses. Some nurses will, but not all are going to be like this. And rarely, with what I'm going to be talking about today, rarely have I heard families say that doctors have communicated with them like this. All right. So before I go into that, let's break down these three types of nurses in this process that you are more than likely going to deal with. And the first one's going to be the labor and delivery nurses. These are the nurses that are right there at the initial jump with everything. They're here with mom and the family. They're there to educate you on this process, monitor vital signs for mom. They're there to look and see how the baby is reacting to labor and delivery. This is what they are there for. They play a critical role in this process. And because they're going through this with you, mom and baby, they have an opportunity, a unique opportunity to see what is going on during the process. So during this, you may have your labor and delivery nurses. They may be noting things in the record that might suggest issues of possible medical malpractice. So for example, let's say that there is a prolonged labor that's going on and the nurse is noticing that. They will be able to see if this prolonged labor, if there are appropriate interventions that are occurring during this prolonged labor. Not only for prolonged labor, it could be things that are dealing with the electronic fetal heart monitor and the strip. They are there to read the strip. They can see if fetal distress is there, if it's creeping in, and what's happening, what actions are being taken based on this reading of potential fetal distress. They are also there to see if there is a delay in moving to interventions due to fetal distress. Finally, they are there and they can see communication between the medical professionals or between the team. Calling the doctor. Is the doctor receptive? Is the doctor acting in a timely manner? All of these types of things and more, these labor and delivery nurses are able to see. And in some instances, these things will get into the medical records. This could be in either through their notes, through the nurse's notes, or there could be notes that are jotted on the electronic fetal heart monitor on the strip. These things might make their way into the record. Now the baby is born. Let's move on. Baby is born. Baby has a traumatic brain injury, and there is a handoff to the NICU. NICU nurses, they are extremely important in this process. They have specific training on dealing with critically ill babies, critically ill newborns. They are trained to understand what to do. They understand vital signs. They understand a host of things that they are going to have to deal with when these babies are injured and are sick like this. Now, when those labor and delivery nurses, remember I said that they are making records and they're making notes. When this baby gets to the NICU, these NICU nurses also will see the notes and the records that followed along with mom, or with the baby, I should say, to the NICU. They will have access to these types of notes and records. So that's going to be very important. And finally, you've got the postpartum nurses. If the baby is still in the NICU being dealt with in the NICU, postpartum nurses, they play an important role too. They are there to help mom. If mom is there and baby's not there, they are there to educate mom. They are there to help her understand dealing with a newborn, checking mom's vitals, helping out with mom and what she has going on. Postpartum nurses play, like I said, they play an important role too. And they too may have access to some of the records and the notes that have tracked and followed mom to postpartum care. Now, why did I talk about the notes and the records being tracked by NICU and with postpartum? Because in a lot of instances, when families contact us and they say that it was a nurse that told them, or it was a nurse that suggested this, that is because generally it is these nurses in other departments. It's these nurses in NICU. It's these nurses in postpartum, because they are able to see those records and notes as they follow the patients into their departments. And that's why it is critical that you pay close attention to the communication, verbal and nonverbal communication of these nurses in other departments, because sometimes they can help you out and help you be able to understand what may have happened to your baby during labor and delivery. In a lot of cases that we have, like I said earlier, the doctors, they will rarely talk about anything. They will rarely do anything or suggest anything like this. It's generally the nurses who are there, and they will continue to advocate for these babies when they see them and they see something may not look right in these records. Because let's face it, the family has, in a lot of instances, no idea what happened. They don't know. They're trusting that these doctors and these nurses will help them. And in a lot of instances, when these babies have these HIE diagnoses, the doctors are only going to talk about genetics and developmental issues. That's it. They're not going to talk about that third cause of babies suffering traumatic brain injuries, HIE brain injuries, and that's medical malpractice. So rarely are you going to get a doctor that's going to cross or suggest anything on that side. It's always usually going to be genetics and it's going to be developmental. But sometimes those nurses, they will come at it from another angle because they've seen things that the parents may not have seen yet in the medical records. And in some instances, this is what will get families to start thinking and to start saying, look, we need to get our medical records. We need to request mom's records. We need to request baby's records. And we need to request the readings from the electronic fetal heart monitor. And that is what gets parents going on these other tracks to either get a second opinion or to contact someone like myself, a birth injury lawyer. So I know we talked about a lot in this video, but I'm helping you understand how these nurses, of course, they are there to care, to give care and to help, but how in some instances on the medical malpractice front, some of these nurses, not all, but some will hint to families or just come out and suggest to families, look, you need to have somebody else to take a look at this.